Hello everyone, thank you Dan. Thanks for handing me over to talk through the questions today. And welcome to all the participants for attending our forum. Before the forum today, we prepared, we sent out a link to Slido and we asked for participants to provide us with some questions. We've got a lot of questions that have come through from our forum participants. So our focus at this point in the forum will be to cover off on some of those questions. Some of those questions maybe had already been covered in the presentation today. So we're taking care to make sure that we focus on those things where we haven't necessarily provided answers to those questions. We'll focus on the Slido questions first, and then we'll hand over to a live Q&A function where you can post any questions that you haven't got information on or you'd like to ask questions on in the live Q&A chat. So the first question today relates to the Code of Conduct. And the question is, regarding the Code of Conduct, can clarification be provided on the term placing the public at risk of harm? And I'm going to hand over for that question to Susie Fry, who is our Policy Manager at the Commission.
Good afternoon, everybody. So I just wanted to, I guess, frame the answer to this question in understanding that what the legislation is attempting to do by providing us with this broader definition around the public is to allow us to investigate or to take action on a notification where a departure from accepted professional standards or behaviour related to an impairment can be taken for anything where that risk-based behaviour applies to anyone, rather than someone making a notification having to see that behaviour in relation to a particular person. So rather than being held up for someone saying, I've seen some risky behaviour, but I'm not exactly sure who that risk might be borne by, and them having to make that judgment before making a notification. If they have concerns that that behaviour may place somebody at risk, they can go ahead and make that notification. So the legislation has been written to give us the broadest possible space to handle a notification in relation to risky behaviour around those two areas, the departure from accepted professional standards and also from working where an impairment may inhibit their practice. Thank you, Susan.
Thank you, Susie. The next question today deals with prohibited workers. How will an organisation know whether a disability worker has been prohibited from providing disability services in the sector? I'll hand over that question today. That will hand over to Maggie Whitmore, who's our Manager of Complaints, Investigations and Compliance.
Thanks, Susan. The register of banned workers will be on our website. It will have a search function, so you can put in people's names and be able to search, and that register will include the name of the person, the type of order and any conditions associated with the order, any revocations associated with it, and have the dates of the order that the order is in effect. Thanks, Susan.
Thanks, Maggie. The next question also, I think, resides with yourself. It's in relation to the NDIS Commission and also co-regulation, which you mentioned earlier. So how does the VDWC differ from the NDIS Commission? And also, if a notification is deemed reportable to the NDIS Commission, such as sexual misconduct, are two separate notifications required with the NDIS and also the VDWC? Thanks,
Susan. So the VDWC looks at conduct of individual workers. So we are able to take notifications and complaints about workers and investigate and potentially prohibit workers. We don't look at service providers, and so we're separate to NDIS, who register the service providers and are able to investigate both service providers and workers. if there's a notification that is deemed to be a notifiable conduct, we require that that is reported to us. There may be times where service providers have other mandatory obligations, reporting obligations, whether it be to Victoria Police or the NDIS Commission or Child Protection or other bodies, and it would be up to the service provider to determine what other steps they need to take as well as reporting to us. Thanks, Susan.
Thanks, Maggie. We have some more questions. I think the next one is also a question directed to you. For an individual, from mandatory notifications, for an individual to make a mandatory notification to the Commission, what is meant by forming a reasonable belief?
Yeah, so a reasonable belief is, it's not, as I said in the presentation, it's not requiring that you have proof or evidence, but it's something that you've observed or a reliable source has told you about. If you're unclear, if you have reasonable belief, it is okay to call us and we can talk you through what you know or what you think you know and what you've been told and work out a process. But it doesn't require that you know for certainty that a conduct has happened. It's that you understand and believe that it's happened and you let us know, and then that's our job to investigate and determine the most suitable course of action. Thanks, Susan.
Thanks, Maggie. The next question relates to workers screening. I'll direct this question today to Susie Fry. What do we know about the worker screening process, and will unregistered workers be subject to the same safety screenings as registered disability workers?
The National NDIS worker screen that is coming into effect next year in Victoria will come into effect after the worker screening legislation is passed in Victoria. That's been introduced into Parliament last week, I believe, but is not yet passed. And so workers who work in the NDIS will partake of that worker screening process. In terms of unregistered workers will be subjected to the worker screening process that's mandated by their employers, and that's not the same as registered workers who have to undergo a worker screening process from the VDWC Commission. And that will look in terms of content, in terms of what we're screening for, that will be very similar to the NDIS worker screen, but it won't be handled by the worker screening unit. It will be handled by us in the Commission. So we'll be checking the same kinds of elements of the criminal history, but it won't go through the worker screen area that handles NDIS worker screen. So it's a different process, but the same content, if you like. Thanks, Susan.
Thanks, Susie. And our final Slido question today relates to the wearing of masks. Somebody asked a question in relation to the wearing of masks. We see staff not adhering to health restrictions or mandated surgical masks and protective equipment and the physical wearing of masks and not adhering to the health rules. Should these be reported? Maggie Whitmore, can I direct that question to you, please?
Yeah, thanks, Susan. So the short answer to this is yes, you should definitely report this to us. And as with any notifiable conduct, we'll make an assessment of that conduct and may investigate it. But it's also worth noting that at the moment there's legislation in Victoria that requires people to wear a mask when outside of their home. And so there are also other avenues for reporting this behaviour and other avenues to address it through the Victoria Police as well. Thanks, Susan.
Excellent. Thank you for that, Maggie. This takes us to the next part of our forum session. Dan, we have several live questions that have been posted in our Q&A.
Right.
All right, great. One of the first questions that we've been asked today is in relation to the Commission investigating or conciliating a matter. So where the Victorian Disability Worker Commission decides to investigate or conciliate a matter, will the employer and disability service provider be informed? And can the provider, oh, sorry, I've just lost my question.
So why don't we start asking that, answering that question about just informing the provider?
Yes.
Maggie, can I just get you to speak to sort of the process of when there's been a notification? So in this sort of case, we're talking about someone who's maybe a worker making a notification about another worker, and the sort of steps your team go through just to help people kind of understand that procedure a little bit.
Yeah, sure, Dan. So when we are investigating, obviously we need to consider privacy. So there are a lot of variables as to what we can and can't share, and they will depend on circumstances. So in the circumstance that, say, a disability worker from one organisation makes a notifiable report on a disability worker in another organisation, it's quite possible that they won't be informed about the outcome of that notification unless it results in a banning order, which would then be public. However, if we were investigating it, it would be likely that you would be requested to attend an interview, and in that circumstance you would certainly know that we are investigating, but possibly not the outcome. If we chose to counsel a worker, it's unlikely that somebody outside would know about that unless the disability worker chose to share that.
Yeah, so it depends on the seriousness, doesn't it, Maggie? And
Exactly.
you know, there's a spectrum of levels of seriousness that we need to respond to proportionately, and sometimes that's going to necessarily include telling the provider. And of course, we all know that sometimes some workers are employed by more than one provider, and sometimes directly by people with disabilities who are self-managing different packages and that kind of thing as well. And we take that responsibility fairly seriously about whether we need to let those either providers or people with disabilities know about certain conduct and our response. And of course, our response at the highest level, when we exclude someone from the sector, that's something we of course publish on our publicly available register.
Exactly.
Susan, sorry, go on, Megan.
Oh, I was just going to say, and it's worth noting, and I did say it in the presentation, that the Act does allow us to provide a final investigation report to a service provider or someone who engages the disability worker in certain circumstances. And again, Dan, that would be your decision as Commissioner as to who we release that to, and again, dependent on the seriousness of the situation.
Great. Susan, any more questions?
Yes, we have a few questions coming through, Dan. The next question relates to defining what is a disability worker. Is the disability worker only limited to the role of carer or other medical staff? Are allied health workers also disability workers? And what medical staff are excluded from the disability worker definition? I think either Dan or Susie could respond to that one.
Yeah, this is a really good question, because it's important to understand. I talked about this briefly in the presentation, but it's helpful to understand that a disability worker, it's about the work they do, and they could at the same time be maybe an allied health professional, or they could be working as a teacher or other kinds of work, but their work is for someone with a disability, and their work is about dealing with a barrier related to their disability. So the one we often think about is with a teacher. If they have one or two children with disabilities in their class, you wouldn't call them a disability worker because they're teaching a mainstream class with children as part of that class with disabilities. But if they're teaching a class of children or young people with disabilities, then that's they're clearly being a disability worker at that time. Do you want to add to that a bit, Susie?
Yes, I'll just take myself off mute. Sorry for the delay there. Yeah, so to satisfy the definition of a disability worker, it's about the nature of the work and the contact with the person. So you have to have more than incidental contact with the person, or manage or supervise someone who delivers those services directly to the person, and the nature of the service that you're delivering. So that service has to involve supporting, caring for, treating or managing that person's limitations to undertake activities in relation to communication, social or economic participation, social interaction, learning, mobility, self-care or self-management. So the definition in our Act is really very broad. And as Dan was talking about, you can take an example of someone in many different kinds of jobs where in some circumstances they're definitely a disability worker and in other circumstances they're not. And so for example, a nurse may be working in a mainstream hospital where they're tending to someone with a broken arm who happens to have a disability, and they're not a disability worker because they would be doing that same service to someone whether they had a disability or not. Or they could be a nurse who is providing a service specifically to support someone with disability in managing their disability in order for them to be able to participate in a job situation, for example. So their service would be specific to that management of that disability, in which case they are being a disability worker. So it's the combination of the type of work that they do and the service recipient and the amount of contact that they have with that person. So the definition is quite broad. It's not limited to specific roles that we might have labelled as disability workers. It's related to the nature of the service and the support that they give.
Thanks, Susan.
Thanks, Susan.
Thank you there. We've got a few questions today about worker screening and also some questions in relation to DWERS and VicPol and NDIS worker screening. So I'll try to integrate those so that the question's meaningful. One question that we've got is, must workers in Victoria now be screened against DWERS, VicPol, NDIS worker screening and VDWC? And is there an explanation or some information on how these systems will integrate or supersede one another as screening services?
Yeah, so I'm going to start on this, but Susie or Maggie might probably need to add to it. But essentially, if you as a provider or a disability service provider have obligations regarding your funding agreements and the like to either notify or undertake certain screening, that still stands. So notifying around DWERS, the Disability Worker Exclusion Scheme, until that scheme stops requiring notifications, you will still need to provide notifications to the department about those kinds of incidents, whilst also if there is a certain conduct that we've outlined and can explain again, but we will provide documentation about that to you, then you would notify us about those types of conduct. So those requirements by different bodies do continue at the moment and not replaced by us. Susie or Maggie, do you want to add to that for me?
Yeah, I would just add that I think over time, as the requirements to DWERS or the ACR, the annual complaints reporting, change, you will be notified of that by the department, not by us. So we won't be taking over the management of those requirements. They will remain with the department for as long as they remain. And if they change, as I expect they may, that will be a matter for the department to notify you of, not us. Thanks, Susan.
Thank you. In relation to talking about the scheme, A question's come in, which is linked, I think, to the previous questions and answers. Our experience as a provider with DWES has been that we terminate employment for serious misconduct involving substantiated abuse, and DWES does not exclude. The worker then goes to work elsewhere in the sector. The question that is being posed to us is, how will the VDWC be different?
Would you like to start answering that one, Maggie?
Yeah, sure, Dan. So once we have a notifiable conduct that we've investigated and we determine that there is required to be a banning order, that means that that person cannot engage in employment anywhere in Victoria. And as I said in my presentation, we do have reciprocal information sharing agreements with other entities in other states, but that banning order is public, it's publicly searchable, and it determines that they must not engage in any employment as a disability worker within the state of Victoria.
Yeah, and I think that's really important to remember, that the power of this commission, which is different to other sort of oversight bodies in the sector, is that ability to say you can't work in any area of disability, no matter how it's funded in Victoria, and that's a key feature of the underlying approach to safety that this commission takes. Thanks, Maggie. Susan?
Yeah, thank you. We've received a couple of questions in relation to the public register, the list of the public register. I'm wondering whether you, Dan, can talk about what that public register is and when that will be available, and how people will be able to check it when it is available.
Sure. So there's two forms of public register. The public register, which is the publication of our prohibition orders. So after we've conducted an investigation, one of the options available to me is to prohibit someone, like we just said, from working in the sector ever again in Victoria, or there can be a limited prohibition order where we might, an interim prohibition order, which might be something we might do whilst we investigate a serious notification or complaint. We might prohibit them for, say, 12 weeks whilst we do that. And that's a public register. We publish that on our website. We can put the link in to where that'll be. And we're also planning to put a link on there so that people can at the same time check the NDIS Quality and Safeguards Commission's register of banned workers as well. So that's our public register of excluded workers from the sector. Then there's also going to be a register of registered workers. And so worker registration, as I mentioned in the presentation, commences from 1 July next year. And there's 3 months people have to undertake registration, complete registration. And so from 1 October next year, there'll be a publicly available register showing all registered workers. We're going to be providing a lot more information about that in the first part of next year. So please stay tuned, and please subscribe to our e-news to find out more about our worker registration scheme.
Thank you. There's still a few more questions that are coming through. The next question relates to one that I know that we touched on in our presentation about the Disability Service Safeguards Code of Conduct. The question is, how does the Code of Conduct apply to an organisation as a whole, specifically in regards to, for example, medication management? If an organisation does not have an appropriate, up-to-date, clear and concise medication management policy and procedures for staff to follow, and if an incident occurs, is the organisation as a whole accountable for the incident, as well as the individual staff member involved?
Yeah, the powers of the Commission don't extend into organisations per se. We have powers to investigate workers, so people directly providing services, and staff who supervise them. We have less powers, and we aren't able to investigate organisations per se. Do you want to add to that, Maggie, in terms of our investigation powers?
Yeah, thanks, Dan. We acknowledge that it's a complex environment, and there are policies that each service providers have that are slightly varied, and some service providers have more fulsome policies than others. We look at the individual conduct, and whilst we're not looking at the service provider's conduct, we would look at it in the context of what information and what training a disability worker had when being asked to do something. And we would take that into consideration in looking at that individual conduct. We are very much wanting to educate and raise the bar of the sector. We're not here to we want to reduce risk, but we're not here to be punitive and unnecessarily bureaucratic. We're here to support workers and lift the sector. So it's very important to us to understand the conduct within the context of the information provided, and we will work with disability workers to do that.
I think that's a really good reminder, actually, Maggie, that although we don't have specific powers in terms of investigating organisations per se, there is a mandate for the organisation to raise quality in the sector and promote good quality. And if we see systemic issues arising in the sector, we will want to publish that in our reporting, our publicly available reports and that kind of thing, so that there is an understanding of key issues that are coming up more regularly or systemically. Back to you. Thanks, Susan.
We have a question in relation to disability workers and how they can be protected. A participant asked, what are the provisions are there to protect workers from malicious reports?
Yeah, our Act and the procedures we've developed are very carefully done to ensure a lot of consideration and careful consideration of natural justice. We don't take lightly the powers we have. I certainly don't take these powers lightly. Maggie, do you want to talk a little bit about those protective factors in terms of how we deal with workers and consider the risk to workers and all this as well? Because we recognise that this is a workforce that the vast majority of people are doing amazing and really good work, and that's something that was also clear in the parliamentary inquiry that recommended the establishment of this commission too.
Yeah, thanks, Dan. I think that's a really good point, that the vast majority of workers are great. They're here working really hard in a very difficult job that's not very well recognised by the rest of society, I think it would be fair to say. Our job is to take those notifications and assess them. And as part of that assessment, we need to go to disability workers and discuss the contents of those notifications with them and make an assessment about that response. So all disability workers will have an opportunity to respond to allegations. A banning order could never happen without that due process. We would always be putting those allegations to you. You would have opportunities to respond to all aspects of the allegations and to provide us with any evidence. Also, as I said before, when a notifier only has to have reasonable belief. It is our job to do that assessment, and we take that role very seriously. The Commissioner will not be given information that we haven't tested and investigated to the full extent of our abilities.
Thanks, Maggie. Susan, one more quick question before we wrap up today.
Thank you for answering all those questions. We're getting a lot of questions coming through. I know we spoke a bit about the DWES scheme, but there is another question that's come through. And the question is, do we still need to report using the annual complaints reporting portal, even if there has been no complaints or misconduct? We were required to do that last year.
Sorry, I didn't fully understand the context of the question. Susan, can you just repeat the question?
Yes, I will. The question came through. There were two questions. One was in relation to do we still need to use the disability worker exclusion scheme check when hiring?
Yep.
And the second question, part two, was do we need to report using the annual complaints reporting portal?
Yep. So very quickly, as I indicated before, your obligations around other processes like DWES continue for the moment. Those until you're advised by, say, the department, DHHS, that finishes, you're still required to continue to comply with those processes and notify them of incidents, and that will go on for a little while, overlapping with this Commission's notification requirements. Maggie or Susie, do you want to briefly add to any of that?
Just to reiterate what I said before, which is those requirements for reporting and notification to DWES are managed by the department, not by us. My understanding is that at the moment they're all still in place as they have been. I expect that they will change in future, but the department will advise you of that, not us, because we don't manage that scheme.
Yeah. Thanks, everyone. I'm going to wrap it up here. We of course did receive a number of questions that we weren't able to get to. We've tried to group them and answer them as best we can. We are going to review the questions and provide some responses where we can to key issues that were raised and everything. So please stay tuned, and we're going to send out some information to those who have registered for this webinar. Thanks again, everyone, so much for coming along, and please stay tuned and register on our website for more news and future updates and information and guidance from the Commission. I'd also like to thank everyone from the Commission who's been able to support this webinar. Really appreciate it, and thank you in particular, Susie Fry and Maggie Whitmore. Thanks, everyone. Bye for now.